Hi everyone, Dr. Bozeman here. I wanted to create a new video that explains the neurofunctional pain management program for nurses. The prior two videos I have made about this were quite long, and I understand it's difficult in a lot of busy schedules to watch or listen to such a long video, but there is a lot of information to cover, and the best way to do it is to just have it in the video format like this. It's so much easier to just listen or watch. That being said, I'm going to try to make this video shorter. I have covered topics and talked to literally thousands of nurses now at this point and kind of collected a very truncated version of all the information that most nurses are looking to understand. So first thing I want to do is tell you a quick story. I do mention this story to a lot of people. It's a story about a patient named Gail. That's obviously not her real name, but she was a patient with chronic peripheral neuropathy. She 20 years, I believe, 20 years with chronic neuropathy pain, working with a number of doctors. As most of you know, any patient with chronic pain for more than a few years is bounced to many different doctors. She was working with a neurologist. The neurologist was actually working with her for most of those 20 years, and she was primarily only working with this one doctor now for her pain issue because no other pain doctors were willing to work with her, just for various reasons. Once the pain doctors try a couple of things that they can offer and it doesn't work, they don't have much else to offer, they'll just send them to someone else. So she had been with this neurologist for all those years. She saw an ad for our program, asked her doctor, said, "Hey, can I do this program?" He said, "Sure. I don't see any reason why you can't. It looks safe. It's not a procedure. There's no medications. I mean, hey, give it a shot." At this point, he was thinking, at this point, if it can help, sure. He wasn't too particular about it. But she came in on a four-post walker and had to have help even then to get in and out of chairs. This is back when we used to have the program in offices, and that was years ago. So she came in, could barely get around. Went through the program. About halfway through the program, she was coming in with just a single post walker. Did not need assistance to get in and out of chairs. By the end of the program, she was effectively bouncing into the office. She came in on, I think it was her last day of treatment. She came in and she danced a little jig in the middle of the room in front of the other patients and told them that that is what they could expect by doing this program. It's such a great story. She got her whole life back. You should have seen her before and after. The before was just a rundown person who effectively was on their way out, if you will. The end of the program, she was a patient, she was a person who was excited for life and was going out with friends and going out with her family again and doing things and very active. And she loved walking around and doing everything. Here's the cool part too. I mean, this is not just, you're not just treating pain, you really are changing lives. And everything I just described is life changing for someone like that. But she's out of pain. She's down to, I guess, a 0 or a 1 on the pain scale. I can't remember where she landed, but she's claimed to be fully out of pain after completing the program. And a couple months later, she shows back up at the office to show everyone her brand new driver's license that she has not been able to acquire for the last couple of decades when they took away her license for health reasons. She's driving again. So she got her license back, got her life back. All these things happened because she was able to get out of chronic pain. And I like to tell that story because that's what we're doing here. There's so much more than just pain treatment, right? The people that you know who are in chronic pain, the pain controls their life, and that's the sad part about it. You're talking about everyone from uh, younger and even middle and younger age patients with pain issues, a lot of times from accidents, car wrecks, and other things like that, with persistent and ongoing pain issues. But the harder part is when you see the older population, the in the Medicare population, right? Effectively, the grandmas and grandpas of society with chronic pain issues that can't really spend time with family or friends or do anything, right? Their life is limited by the pain, and it's really hard to see that. So that's what we're doing here. We really are doing something great for society and for patients. And I put that in all the posts and things we have for nurses. I put that out there. Do something great in your life to help these patients, and you're going to love it when you see these patients get out of pain. it's going to change your life too. And all the nurses that do this, they come into this, even if you're excited or just kind of, checking this out to see if it works. When you start seeing these patients get out of pain, that does start to change your life too, right? So that's the little story I want to tell you about. Okay, so I'll jump straight into this. Neurofunctional pain management. It is a three-part program. It uses electroanalgesic therapy, IV hydration therapy, health coaching. Okay. The primary pain relief component is electroanalgesic therapy. This is a high pulse electrical therapy. If you are familiar with the TENS unit, most people are. The difference here is that a TENS unit is a muscle stimulator. Electroanalgesic devices are neural stimulators. So it's very different, right? They stimulate completely different categories of tissue. They do completely different things. The device that we use can achieve, or I say it can work in some of the lower frequencies like a TENS unit, but it is FDA cleared and qualified as an electroanalgesic device. So it can do neural therapy. It can do neural tissue treatment. That is how it gets people out of pain. And it does that if you were to imagine this, an electrical pulse that is, pulsating and hitting that neuron, that nerve, and it does it so fast that the nerve cannot repolarize. So normally you depolarize the neuron, and then it takes a fraction of a second for it to repolarize, and it's ready to fire again, right? You hit that nerve so fast with high pulse therapy that it can't repolarize, and when it stays depolarized, it inhibits the ability to send pain to the brain. So the brain is now no longer sensing the pain, right? Because it's being blocked. Now, the benefit of that is that you have this pain and inflammation cycle. If you can reduce the inflammation, or sorry, if you reduce the pain signal, the brain automatically shuts down the inflammation cycle. And you start winding down that pain inflammation process, whereas in a regular pain cycle, it winds up, right? And any type of additional inflammation that's introduced to the body will people say it all the time, it triggers the pain, right? Yeah, so all these sorts of things can actually cause the pain to recur just by having additional inflammation or stress, all sorts of issues that patients have, even just like I said, just stress and bad sleep, eating something that didn't agree with you, all those things can add stress and inflammation, all that kind of stuff can actually trigger pain. That's, the current chronic pain issue that you have. So when you de-escalate that pain inflammation cycle, you start to see that successful pain relief outcome. And there's there's a lot more to learn about that. I'm breezing through it, but there's a lot more to learn. But that's the basic premise for what we're doing for pain treatment. The hydration therapy, it's a vitamin mineral mix. It's very simple. It's not a medication in it. The hydration component here is actually pretty powerful. I've had a lot of nurses I've talked to who are very much involved in this current field of patients, like the chronic pain patients and retirement centers, nursing homes, and they see all this, and every one of those nurses, they're like, I can't believe that somebody's finally acknowledging that the chronic dehydration present in all these patients is a contributing factor to their chronic pain. And of course it is, right? But no one's really putting that together, and no one's making it a medical priority, right? You have all these doctors and all these protocols and all these things out there. Treat this, pill here, injection here, all these things, and nobody's paying attention to the basic chronic dehydration the patient has, and the chronic malnutrition of various vitamins, minerals that the patient has, contributing also to the pain. So when we decided, we figured this out years ago, that when we would combine the hydration component and the electrical therapy component, it produced an even better outcome. And there's so many reasons for that. And there's just so many things going on with the electrical therapy that are beneficial. One of those little beneficial things I'll mention here is that in addition to that pain blocking cycle I mentioned earlier, there is a release of neuropeptides. So there's, your nerves are releasing neurotransmitters and neuropeptides. Some of those neuropeptides are directly impacting what's called vascular permeability, right? So some of those peptides are actually stimulating the vascular permeability of the peripheral vessels. So all of these blood vessels down in the lower extremities and in all the small vessels you're thinking of, they're now becoming more permeable to the fluids and the nutrients that you're introducing through the IV, right? So there is a component. There's a synergy effect occurring when you do both those treatments together, right? And then, of course, the third component here is the health coaching. And the health coaching component here is also pretty important because we have a lot of patients who they see what's going on. They're getting out of pain. Most of these patients, they've been, I guess hounded, what do you want to call it? Pounded on, hounded, it's been beat into them, all these different things. You should eat better, you should exercise more, every good thing, and of course in polite ways, but oftentimes, they're hearing it constantly, but they're not really taking it seriously. Some patients do, but changing health habits it's a very difficult process. But here's what we noticed. When they start getting out of pain, they will actually start taking that health advice very seriously. Okay, I'm out of pain. I have been out of pain for 10 years. And they're telling me that if I eat better, get some more exercise, drink more fluids, all these things, it'll help me stay out of pain. Okay, I will do that, right? So suddenly they're taking it more seriously because previously they're saying don't eat poorly, avoid all these foods, all these things, but they're still in pain. So there's just less incentive for them to care about all this extra effort when at the end of the day they're still just in pain, and a lot of them are looking for some sort of comfort, and a lot of people take comfort in all sorts of foods and drinks, things like that aren't good for them because they're still in pain regardless, right? So why bother suffering in one area when you can just you're already suffering in the other one, right? And that's how a lot of patients think about things like that. But the health coaching is a big part of it, and we've had a lot of patients who have been very grateful for the health coaching, and it also produces longer outcomes. So what are the outcomes? We have most patients get better with this program. Across the board, if you talk to, all the doctors we've worked with over the years, all of them have agreed that they believe the average is about 85%. So 85% of all the patients coming through our system are going to achieve success. And that success is measured by it's a 50% or greater reduction in pain. That's how all these pain doctors around the country kind of mark that success rate of the program. If we achieve a greater than 50% reduction, that's a success. Now, I do know pain doctors, when they do, pill regimens and alterations and things like that, they're aiming for a 10 to 15 to 20% reduction in pain. That's what they're aiming for, right? So for us to achieve a 50% reduction is tremendous, right? And a lot of patients, probably about somewhere between 30 and 40%, are going to achieve a 0 or 1. So what we call a full pain resolution is down to practically 0 on the pain scale. It's very common for patients to achieve that. So on average, 85%, but we have studies and publications and things like that will show patients, we have over 90% success rate with neuropathy. That's a very strong category for us. And then also too, things like fibromyalgia. We're working on a study right now for that one, but in the past, we've talked to doctors where they all agree that the fibromyalgia patients got better at a higher rate of success than even other conditions. So we know that's a strong one. There's so many pain conditions we can treat, about 24 different types of chronic pain. So we know that across the board, if it's 85% successful among 2 or 3 dozen, that's over 2 dozen different pain conditions, then yeah, I mean, most patients will want this. And what we've noticed too is that patients will want this more and or want this instead of medications and surgeries and invasive procedures. And that's obvious to us. It's obvious to you that a patient's going to want this, a non-invasive, safe treatment that is performed at home versus getting onto a stronger medication, versus getting spinal injections or steroid injections, or lining up for a spinal cord implant or for some other surgery because of the pain, right? So they're all going to want this. And we've noticed that over the years that when this program does work for a patient, which again, it's most of the time it does work, this is what they want to do. This becomes their pain treatment plan, right? We've had patients, when I first started doing this, I opened up the first office doing this in 2018, working with a doctor who was a former partner, a good friend of mine, put the program in his office. Tremendous success in the first couple of years doing this. Talked to him recently, said that he still had a substantial number of patients from that very first year that come in every single year and do the program again and they get out of pain. They complete the program and they will typically go 3 to 6 months. So wherever the patient landed at the end of their treatment, they'll typically have a 3 to 6 month success window afterwards. So it'll continue to be out of pain for that long. So 3 to 6 months later, you're getting back into a state of pain. and then they call back up and say, hey, can I get back in the program? Because I'd still want to do that versus the other options that the other doctors have. So it's, you see that all the time. Some of the nurses working with us right now tell me that almost all the patients on their schedule, and in one case, I had one nurse tell me that 100% of the patients on her schedule are all repeat patients. So when you're looking at this from an independent contractor business perspective, that is one of your strongest avenues of long-term success, is that once the patients do get out of pain, they're going to stay with you, and they're going to do this program on a regular basis, year after year after year. To my knowledge, there's no reason why a patient can't do this for 10, 15, 20 years. If this is what works for them, there's no reason why they can't do this indefinitely. It's safe, it's effective, it's covered by Medicare and commercial insurances. And I haven't mentioned that yet, but it is. So when it comes to Medicare, we are pretty confident about what, coverage there is and how it works and everything. With commercial insurances, that is all over the board. And I do talk about this here in a second. We're going to get into the payment model. But you're looking at, a standard Medicare acceptance of this program. We're using standard codes. We're not using extravagant high dollar codes. This is all very therapy-based codes. Everyone's familiar with these codes. When it's being used to treat chronic pain, it's accepted for that purpose. So everything in the program is covered. The program is an 8-week treatment cycle where the patient's being treated twice a week for an hour each time. And one of those treatments is a regular electroanalgesic therapy with health coaching. And the other treatment that week is electroanalgesic therapy, health coaching with an IV simultaneously. So the IV is set and runs for the duration of that hour while you're doing the rest of the therapy as well. So those are two different event types. You've got, that we call it EA for short. So EA and then EA IV, right? Health coaching is included in every single one. So that's the kind of the easy format for how you understand this. Over the course of 8 weeks, the patient will be treated 16 times. And that actually adds to the structure of your schedule. Because when you have a patient that comes on board and they're ready to get started, you can book them out for 8 weeks, right? So now you have a structured schedule for the next 8 weeks. You know who you're going to be seeing, right? At a certain time. And most of these patients do want their preferred time. I'll say that that's their hour, right? They will want their hour at the same time every single week. That's what they want. And if you change that around, they'll get upset. So don't do that. But you'll have 8 weeks of booked out schedule. And we have a lot of nurses that come on board with us who are doing, cash pay things and cash pay IVs and concierge work and other stuff like that. And that's a great category to be in, but it's hard when you can't really guarantee what all work you're going to get next week or the week after, because when it's cash pay and it's cash pay IVs, people pick and choose when they want those. With this program, and it's being covered by insurance, you're going to have much more acceptance from patients to do the program because they're not paying cash for it. And it's structured out for you, which gives you some sort of stability to your schedules, which is great. Okay, so pay structure and everything. So obviously this is a 1099 position, which means that the nurses are responsible for buying all their own equipment and supplies, right? We have put together an equipment package for the nurses to purchase. It's using the Neuromed PMT mobile system. That is the device we use. And I'll send you the information on that when we do our calls and we talk after you watch the video. Then the equipment package for that's $30,000. I know that seems expensive. And a lot of nurses will, sometimes just say, oh, that's the end of the conversation right there. And I get it. It is expensive. But it can produce over $250,000 a year in revenue if you have a full schedule consistently the whole year. And, that device alone can last for 20 years. I've met doctors who are still using the exact same device. They've had it for over 20 years. So, and it's never malfunctioned on, never stopped working. So that being said, I mean, it's expensive, but it's a long-term investment. And like I said, when you have all those patients that are lining up for their annual treatments, you will also have a long-term business venture going. You'll have patients lining up to do this repeat treatment over and over and over, right? For the next, 10, 15, 20 years. And I did mention earlier, I didn't mention it, but when patients have multiple pain conditions, they can do an 8-week program for the one condition, neuropathy, and then they could do another 8-week program for the other condition, back pain, whatever it is, right? Insurances, they recognize each pain condition as a separate thing. So you can do a program for this and then a program for that. What we don't do is we don't bounce around between the two because we have to have some sort of stability showing that we are treating this one condition at a time, right? So you do that condition for 8 weeks, close out the program, document the results, and then do the next condition for them. So with these patients, you're looking at some very long-term activity for them. So that being said, going back to the cost of the equipment, that equipment package includes the equipment. We also includes our online platform, obviously the training, and the marketing. And I'll get to the marketing here in a second. But in addition to all that stuff, we also include $2,000 of a credit for IV supplies. We do have all the IV supplies in our system, and so we just apply a $2,000 credit to the system. You can order whatever you need for IV supplies to perform all the activity, right? So that's part of it too. For marketing, so a lot of nurses out there. It's funny because anybody who is more than 5 minutes into our conversation or this conversation, and they know how all of these kinds of programs work, that's the first question to ask is, how do I get patients? Where do you get patients? Because every one of you out there have probably been pitched by 100 companies, and then you're the one who have to get the patients, right? And that's part of the process, right? So you're going to end up with the outreach portion. You're going to end up having to talk to the patients, but we will do the marketing part of that. And I'm going to explain the the 5 categories of patient flow that structure in our process, right? So you come on board first thing, and we start doing paid ads, right? So paid marketing, and that consists of Google ads and Facebook ads, okay? And that is designed to get you introduced to that patient and to the patient's doctor. In our model, we are registered around the country in every state as a medical service group with medical directors, and we bill Medicare and commercial insurances directly as a company. We do still work with a few other practices as ancillary service providers for them. That is still going on, but primarily we operate as a medical service group ourselves. But what that means is that any doctor can sign the order form. So if you have we do marketing, and say you have a patient, Mrs. Jones, she wants the treatment program. She has an internal med doctor that she works with actively, and she presents that to him and says, hey, I want this treatment. This company RELATYV is offering it. The nurse will come out to my house and do my treatment. The doctor looks at it, sees that it requires a couple of screening questions, and obviously the doctor will already know those questions because that's an established patient. So they'll look at it and see that it's safe. All right, so there's no non-invasive, there's no medications. Okay, yeah, sounds good. I'll sign this. Doctor signs it, hands it over to us. Now we can conduct the treatment program, right? So then you go out and you start treating the patient. The benefit here is that we found that patient from marketing, but it opened up the door to that doctor, that internal med doctor. The patient starts getting better after a few weeks of treatment, and suddenly that doctor is very interested in how that worked. Most doctors around the country are very pleasantly surprised at how effective the program is. The most doctors are unaware of it, first off, and I can explain that, and I used to go into all of that. Not necessary, but just understand that this device and this treatment has been FDA cleared and approved for pain treatment for over 30 years. So this is not something that's brand new, right? It is brand new in the world of managing chronic pain because most doctors have not been using this device for that purpose. They used to use it for nerve blocks and specialty pain relief and things like that in different settings. We're using it for chronic pain treatment. Perfectly, it's a great device for this. But, for the past 30 years, it hasn't really been used for that until I started doing it in our program back in 2018 and ever since then. And it's spread like that since then. So that being said, most doctors still have never heard of it. They've heard of tons of electrical devices, but they've never heard of this, and they've never seen this work. And they will see it work, and they will see it be very successful. And a lot of these patients are going to go back to their doctor, and they're going to rave about how much they're out of pain, how they can sleep again, how they feel great. And the doctor is going to be very impressed, and they're going to start sending you more and more patients. So that's the second one. So you got the first one is, paid marketing gets the first handful of patients in the door. The second one is that you've got doctors that are now seeing the success and referring patients. The third one is that the patients who get better are going to refer their friends and family, sometimes very actively. And you should definitely encourage that, right? The hardest part here is that a lot of nurses, and you come from bedside nursing, hospital nursing, work has just been assigned to you, and most of the time you don't really get to pick what you're doing. You just do what's asked, and they assign you patients, they assign you work, and you do it. Right? This is very different. In this model, the patient chooses you, and you choose the patient. Right? If they don't want you to come to their house, then you don't come to their house. If you don't want to go to that person's house, or it's too far, or whatever the case may be, you don't have to, right? It's your call. You're an independent contractor. You don't have to go do anything, right? So that being said, if you can build a good relationship with those patients, which most of you do, then they will start referring all their friends and family. So that patient referrals becomes a very strong avenue. We've seen that happen many times, where a single patient will refer in more patients than you can actually handle. Third one is organic traffic. We have, if you can imagine, Google's a good example. Google likes to promote options, right? If you are searching for something, they don't just want to send you one result. They want to send you multiple results, and they want to make sure that you see all of the most relevant results, right? There is no other mobile pain treatment program in the country. We're the only ones, right? So when Google sees that we have a nurse in the area, we get ranking very quickly, and that those patients out there looking for pain treatment, we pop up. Okay, here's Dr. Jones' pain management office has been established for 10 or 15 years in your area. Number two, we have a great mobile program that's available, and then they click on ours because it's mobile, and most patients would love to have someone come to their house and do this. So Google helps us a lot. All of search engines are doing this for us because we have a mobile program. It looks interesting in the search system. And so they promote that out there as well, very actively. So organic traffic is a very strong category. We get hundreds of patients a month, or hundreds of leads a month going out to the patients, to the nurses, excuse me, all over the country from organic searching and traffic. And then the fifth one is the most powerful one, which is the repeat nature of the treatment. Patients will stay with you for years, doing this 8-week program every single year, sometimes twice a year, right? When you have that long-term, stability in place, you're good to go. Okay, so how much does a nurse get paid? Uh, for Medicare and federal payment plans, we do a flat rate. That flat rate this is per treatment event. That flat rate is going to average somewhere between 150 and 170, depending on the state that you're in. But I would say the good average is 160. So count, on that average of about 160 for the flat rate, and that is for the Medicare and for federal paying activities. For commercial, it's 60%. We can do a percent model with commercial plans, and so we do that. The reason for that is because commercial is so variable. It's practically impossible for us to guarantee any certain amount. And you ask any doctor this, they'll tell you the same thing. Like, oh yeah, we know what we'll get paid for Medicare. We have no idea we're going to get paid for commercial. I mean, even after a commercial, says they're going to cover something at a certain rate or whatnot, they may, they might delay it. It might take months for that to get in. They might do a partial payment, then a full payment later. I mean, so all of these different scenarios make it very difficult. And again, there's dozens of different commercial plans in every region of the country. So everywhere you go, you've got a whole new set of commercial plans with different rules, different policies. It's very difficult to keep track of all of that and be able to do a flat rate, right? So we do 60% of the commercial work, and the flat rate for Medicare work is going to be about 160. If you're looking at that 160 per event on average, you'll notice that, let's say that you carry let's call it 5 patients, right? 5 patients being treated twice a week. You're looking at 8 total treatments per month. So it's 8 times 160. It's like 12. Excuse me, I'm going to do some math in my head here. It's over 1,200 a month per patient. So if you have 5 patients that you're carrying consistently all year long, which is it's less than part-time, about part-time really. You're looking at about 6,000 a month, right? So and that's with the flat rate model. So and again, that's because 5 patients would equal 2 treatments per week. So that's actually 10 treatment events per week right there. Which if you add in a little bit of driving, to all those patients, you're probably looking at somewhere between 10 and 15 hours. Call it 15 hours of actual out in the field time. And per week, and that's averaging over 6,000 a month for you at the flat rate, at the Medicare flat rate model. Could be more than that with commercial insurance. It's definitely possible for the rates to be higher than that. We've seen some of the commercial plans we've seen around the country are naturally paying, in some cases we've seen 50 to 100% higher than Medicare rates for some of the commercial payments out there. So those can be higher. And then the other side, back note to that is that, it's possible that some of the items they don't even cover at all. They may simply deny the patient the ability to even do the program. That happens sometimes too. So the commercial is kind of all over the board. But when you do have a good commercial plan for a patient that's paying well, it could pay great. All right. And so over time, you will have to kind of, what's the word, cull and or filter, sort and filter through all the patients. You're not going to be able to treat everyone. Some people are going to have insurances that just aren't compatible, right? High deductible plans where the patient's going to have to pay 100% out of pocket for coverage. If they're unwilling to do that, then there's not much we can do. I mean, if the insurance is bad, can't really help them. And so unless they're willing to pay out of pocket, right? And we'll talk about that kind of stuff later. But I just wanted you to understand that as you go, you'll collect this clientele of patients, and most of the people that are going to stay with you for years and years and years probably do have the right kind of insurance, right? A really good Medicare plan, maybe Medicare with a supplement, which is a great combo right there. And all of these different patients you collect where it works for them, they have good insurance, they'll stick with you for years and years. That is excellent for long-term business. So going back to that $30,000 investment into the equipment package gets you off and going. And for some nurses, if you hit the ground running and you know exactly what you need to be doing, this is great. And I've seen nurses jump into this. They know, okay, the marketing is coming, but I have to do the actual, relationship part with the patient. If you understand that, that's great. Make the phone call, talk to them. The moment they even meet you and see you, they're gonna stay with you forever. They're gonna love you, right? So, and the moment they get out of pain, they're never going away, right? The moment you get them out of pain, you got them for life, right? So that's huge. It just takes a little bit to get across that line, right? And some nurses come into this, they come from kind of a passive background, hospital setting or a bedside nursing scenario. They're not used to having to develop the relationship. They're not used to having to depend on expansion of your services, right? Getting referrals, doctors giving you referrals. They're not used to that, and it can be a little bit intimidating. We have people to help with that. We have all sorts of training, all sorts of people. There's teams, all that kind of stuff is going to help you get up and going. It's still going to be up to you. Like no one's going to actually do that part for you, right? We can train you, we can show you, we can help you, but you still have to actually make that part happen, that actual relationship with that patient, that actual phone call, right? To get them on board, to convince them to move forward when they aren't really sure what this is, right? And that's where it takes that relationship part of it. And if you got that part down, if you feel comfortable with that, this will be great for you. We've seen some nurses jump into this and get practically a full load of patients in the first month, 4 to 6 weeks of being on board, and they've got a full load of patients going. That can absolutely happen, right? So I encourage all of you to book a time with me, talk with me. I would love to get you going. We're operating all over the country, expanding rapidly. And I have a feeling as we grow in the next 5 to 10 years, this will become probably one of the standardized therapies that doctors are offering patients before they recommend stronger medication, surgeries, and procedures. They're going to say, well, let's try this first, right? I see that it's already happening in some areas, but we're going to see it more and more. That's my goal, is to get to a point where we have enough nurses all over the country so that this becomes a standardized therapy model that patients can depend on and is available for them before they have to move into the more risky, surgeries and procedures. That's one of our goals for doing all this. So I encourage all of you, reach out to me, book a time with me. Let's talk. I'd love to get you going. That equipment, by the way, the equipment package, financeable. We have lots of different finance partners that work with nurses. Most nurses can get that finance down to somewhere between $500 and $600. It depends on your personal circumstances. We can't ever guarantee anything because when it comes to you doing financing, you're the one that's got a background in the history that they're looking at, and we have no idea what that is. So, but I have seen a lot of nurses get really good deals, $500 to $600 a month. I've seen a lot of nurses also get financing agreements where they don't have to make a payment for several months, and I've seen it anywhere from 2 to 6 months of no payments before you have to start making a payment. right? So that's definitely possible with some of these finance groups. So let's chat. Let's see what we can do. I'd love to talk to you. Thank you so much for watching and looking forward to getting you on board with us here at the Relative Mobile Pain Treatment Program. Thank you so much.